the fall, how it ends. It's the fall, how it ends. Or it's the fall, how we rise again. Ooh.
A very warm welcome to all our PhysioTV viewers. Today we have a very special speaker, Dr. Karthika Prasad. Dr. Karthika is our alumni and she's also a dance movement therapy expert. So that's why the topic for today is moving to wellness, dance and physiotherapy integration. So Dr. Karthika has done her BPTH from Sancheti Institute College of Physiotherapy and Masters in Musculoskeletal Sciences. She is a PG certified dance movement therapist. She has done her Visharad in Bharatnatyam, consultant physiotherapist at Swastik Bone and Joint Clinic, and she's also founder director of Vivanta Holistic Care. She's also an assistant teacher at Amritanjali School of Bharatnatyam. So I guess it's a very, very rare combination where you are a trained dancer, you are a dance teacher, as well as a physiotherapist. So we welcome you, Karthika, and I'm sure that today's session is going to be very, very different for our viewers and very enlightening. Over to you, Karthika.
Thank you so much, Sarojri ma'am, for such a wonderful introduction. Well, I'm really happy and glad to be a part of this talk today. And it gives me immense pleasure to come back to my preschool, I would say, as a physiotherapist. I feel like a baby coming back here and delivering this talk today. So as we get on to the talk, I would like to start my PPT. Okay, so as you can see on the screen, the title for today is Moving to Wellness, Dance and Physiotherapy Integration. So before I move on to the next slide, I would like to say why I chose this topic for today. So basically, I have been a dancer since the age of 6. And as a child, I never liked dancing. But as and when I grew up, I understood dance is not just about a physical activity or an exercise, but it also gives some kind of mental peace or that platform to express yourself. So, well, that's one reason I chose physiotherapy, because I wanted to do something in the field of health as well as continue with dance. So I did not go in for MBBS or anything of that sort because I knew I would not get time for dance. So physiotherapy is my main profession, of course. But when Sancheti Institute also introduced PG certification course in dance movement therapy, I was the happiest to know about it, because I also wanted to use dance in my treatment protocols. So that's why the topic for today is moving to wellness, dance and physiotherapy integration. So The topics to be covered in today's talk are, first of all, I would like to start talking about emotional pain. Then I'll display an emotional pain chart, then and so on. The topics go on. Right. So, emotional pain. So, can pain have an emotional connection to apart from the actual cause? Many a times people come to me with this chronic condition where they keep complaining about maybe low back pain or knee pain. And as and when I get, a little more comfortable, the patient gets more comfortable with me, they start telling me about their household chores, or why is there so much strain in their body? Why are they so affected by this? And then I realized that maybe they are not getting that enough rest, not only for the body, but to the mind as well. There are people who wake up early in the morning at 5, probably go to sleep by 11, 12 at night. So probably they're not getting the time to be with themselves, or, actually treat themselves more comfortably. So yes, I believe that pain has an emotional connection. And what is emotional pain? Emotional pain is pain or hurt that originates from non-physical sources. So it may not have a particular physical reason or cause to it, but maybe probably you've had a hectic day at work, or you had a very busy day with your child. So you have this kind of upper back pain, or maybe a low back pain towards the end of the day, not because of a particular cause. You don't remember doing anything strenuous to cause this pain. So this can be a result of regret, grief, or loss as well. It may also be a result of underlying mental conditions such as anxiety or depression in some cases. What can be the actual causes of emotional pain in long term? I'm not talking about the short term pain here. I'm talking about the long term causes of emotional pain. Sadness, it is a natural emotion associated with loss or disappointment. Whenever we have a loss, maybe a family member or a close friend, or someone or something for that matter, we have this thought at the back of our head, oh, I wish if I could do something to stop this process, or stop that person from passing away, or whatever it is. But this, over a period of time, if it is prolonged and stayed in your mind or body for a long time, can lead to some kind of pain or discomfort. Unexpressed anger. As we all know, as physiotherapists, anger releases adrenaline, which increases muscle tension and increases one's breath rate as well. This also leads to increase in heart rate. This is the fight part of the fight, flight, or freeze response. Anxiety. This emotion also releases adrenaline, leading to a feeling of jumpiness or inability to relax, which is flight, or a feeling of being immobilized or stuck, which is freeze. Anxiety is a very common issue that has been coming into picture for the past 3 years post COVID, especially. A loss of jobs, loss of mental peace, leading to this kind of issues. Shame and guilt. This feeling is common among people with addictions. It worsens the need for secrecy in one's life. Emotional pain chart. So this chart is widely used by the psychologists all over the world today to correlate physical pain and emotional pain. So the emotional pain chart is a chart that gives us a brief idea about what can be the probable causes for pain in specific areas of the body. I'll just run through the image once. So emotional pain chart, mental thought patterns that result in pain. Pain areas and probable causes. So the neck can be related with refusing to see the other side of the question, stubbornness or inflexibility. Shoulders represent our ability to carry our experiences in our life joyously. We make life a burden by our negative attitude. Spine, life support system. As we all know, spine is the main, framework that holds our entire body erect. So if there's any emotional connect, we can understand this by the image here. Upper back or upper spine, lack of emotional support, feeling unloved, holding back love. Middle back, guilt, stuck in the past, or the feeling of get off my back. Lower back, fear of money or lack of financial support. Elbows represents changing directions and accepting new experiences. Wrists represents movement and ease. Hips, fear of going forward when it comes to taking a major decision or a stagnant life with nothing to look forward to. Knees, stubborn pride, ego, and the inability to bend. Fear, inflexibility, and won't give in. Ankles, inflexibility and guilt. Ankles represent the ability to receive pleasure. Bunions, lack of joy in meeting experiences in life. There are some other connections which are also proven by research. Arthritis, feeling unloved, criticism, resentment, fractures, rebelling against authority, bursitis, repressed anger, inflammation, fear, seeing red, inflamed thinking, joint pain, representing changes in direction in life and the ease of these movements, loss of balance, not centered, scattered thinking, sciatica, being hypocritical, fear of money and the future, slipped disc, indecisive and feeling totally unsupported by life, sprains, not wanting to move in a certain direction in life, anger and resistance, stiffness, rigid and stiff thinking, weakness, a need for mental rest. Multiple times we all have experienced weakness without any reason. We won't have a viral fever or we won't have any infection in our body. We still feel weakness. So we can just sit back and think, have we really rested well, not physically, but mentally? Ask this question to ourselves whenever we feel, tired or exhausted, not because of you've had a hectic day at work or a hectic day throughout, whatever. So it's just you have to look back into yourself and try to understand why are you having this weakness or why are you having this pain, which is undefined, which really does not have a reason on an MRI, on an X-ray, or on diagnostic. So, about this session will help you understand the unique fusion of physiotherapy and dance movement therapy. Both these therapies combine the creativity of dance and scientific concepts of physiotherapy. Moving to wellness is a holistic concept that focuses on incorporating physical activity and mindful movement into one's daily routine to promote overall well-being. Emphasizes the importance of staying active, not just for physical health, but also for mental, emotional, and spiritual balance. Movement isn't just exercise, but a way to connect to mind and body, reduce stress, and enhance one's quality of life. The goal is to find joyful, sustainable ways to stay active for a healthier, more fulfilling life. Integrating two different movement repertoires will improve the scale of benefits. So coming to benefits of traditional physiotherapy sessions that we generally practice as physiotherapists. The first one is pain relief. So we use different modalities, as we all know, to reduce pain, reduce inflammation, whether it's from injuries, chronic conditions, or surgeries. Through manual therapy, exercises, and modalities like heat or ice, electrical modalities, etc., we take care of pain. Improved mobility and function. Personalized exercise programs to improve range of motion, strength, and coordination, helping individuals regain their independence and perform daily activities with greater ease. Injury prevention. Customized exercise plans can be formed to prevent injuries and improve biomechanics of one's body. Rehabilitation post-injury or surgery. Physiotherapists work to restore strength, flexibility, and function, enabling individuals to return to their pre-op or injury level of activity. Management of chronic conditions. PT plays a significant role in managing chronic conditions like arthritis, diabetes, heart disease, and more. It helps improve quality of life. enhances respiratory function. Breathing exercises and chest PT can improve lung capacity and help manage respiratory conditions like asthma or COPD. Neurological rehabilitation. Physiotherapists assist individuals recovering from neurological conditions like stroke, Parkinson's disease, or SCIs, spinal cord injuries. Sports performance enhancement. Physiotherapists help to improve performance and prevent sports related injuries. Physiotherapists provide targeted exercises and strategies to optimize athletic ability. Posture correction. This is the most important post COVID, I would say, as I have seen a lot of patients coming in only for back related issues, pain, discomfort, stiffness, etc. And nothing is just postural because they've been sitting at home and working all day. So physiotherapists address poor posture and alignment issues through exercise and education, reducing the risk of musculoskeletal problems. Education and empowerment. Physiotherapist equips individuals with knowledge about their bodies, helping them understand how to manage their conditions, prevent injuries, and make a healthier life choice. Benefits of dance as therapy. As I said in the beginning, dance has always been a part of my life. So I always wanted to pass on dance, not only to dancers, but also to people who are looking for some peace of mind, stress relief, tension relief in their muscles or the entire body for that matter. So as I completed the PG certification course from Sancheti Healthcare Academy itself, I started practicing with adults earlier, offices where I visited them and conducted dance movement therapy sessions. And as of now, for the past 1 year, I've been working with specially able kids at an autistic school in Pune. So I have seen as a physiotherapist and a certified dance movement therapist, when these two entities come into together in a treatment protocol, it gives better results. So we will talk about this in the later slide. So if I only talk about dance as therapy, there are numerous benefits of dance, which includes both physical and mental benefits. It improves cardiovascular health, flexibility, balance, and muscle strength, promotes weight management, and elevates your energy levels. Dance has positive effects on the overall mental well-being of an individual. It reduces stress and anxiety by releasing endorphins that contribute to a happier mood. As dance involves social interaction, it enhances social connections, reduces feelings of loneliness. This point, I would like to speak a little more about it. So, like I said, post-COVID, there's been a lot of issues with mental health among individuals who've been working from home. Also, individuals who are not working, but housewives or mothers who are, at home the entire time with their kids, with their family. When I conducted the initial sessions of dance movement therapy, I encountered women who were at home as well as women who were working from home, and which means they were at home the entire day, 24/7. They had come to me with this issue of, when I started the session of dance movement therapy, they came to me with an issue of low back pain or, stiffness in the neck. So initially, of course, I am not in a position to directly ask them questions about how is their day-to-day routine or what is it that is causing you this chronic pain or discomfort. So then I assess them, then I try to understand what can be the issue. So of course, there was no physical issue as such, but as and when they started getting comfortable with the sessions, the frequency increased. They started visiting me often for dance movement therapy sessions. I started realizing they were opening up. They were trying to tell me we've been really stressed about work, handling kids at home, working from home, or just handling the household chores because there are more demands when kids and the family are at home the entire day. They were really tired and they just realized they never got time for themselves. So when they came for these dance movement therapy sessions, there were times where they really hugged me and they told me, we're so grateful to you because we've never had this time in the past 2 years or 2.5 years because of, and we're really grateful for you, to you for conducting these sessions. It really gives us this peace of mind which we've never experienced for the past 2.5 years. So that's all about this point. It gives an individual a creative outlet for self-expression and thus boost one's self-confidence. Dance truly adds colors to one's life and makes it more joyful and peaceful. Let's talk about integration of physiotherapy and dance movement therapy. It is a dynamic approach that combines the therapeutic benefits of movement and physical activity with scientific background to it. The fusion can offer a range of advantages, as we see on the screen. Holistic healing. So, Vivanta Holistic Care is a firm that I started keeping in mind that I'm a physiotherapist as well as a dance movement therapist. So, as a physiotherapist, I'm very empathic towards patients. So I just realized that if I'm empathic towards patients, if I can understand what is going on, in their heads, or what is that emotional connect to the pain or discomfort, why shouldn't I start practicing combining these two entities or these two movement repertoires? So holistic healing, dance brings expressive movement and creativity into the rehabilitation process, promoting a holistic approach to healing that addresses physical, emotional, and mental well-being. So here I use physiotherapeutic equipments like therabands or maybe dumbbells or weights, anything that is used to strengthen their physical body. And I use music which is going to boost their energy or, just give them a positive attitude towards that session. So that takes care of both physical aspect as well as the mental aspect of one's life. Motivation and engagement. Incorporating dance into physiotherapy can make rehabilitation more engaging and enjoyable. It can motivate patients to be more committed to their treatment plans. This particular point I would like to emphasize with neuro patients where I have taken home visits or when they come to the clinic. After a certain period of time, maybe 2 months, 3 months, they start getting a little agitated because their recovery is a little slower compared to musculoskeletal conditions. And they start getting a little reluctant about physiotherapy sessions. So when I started introducing music, when I started introducing basic dance movements, they started becoming more regular with their sessions and they started enjoying the session. And of course, this led to a better recovery in them and a speedier recovery in them. So this point also plays an important role in the integration part. Motor skills enhancement. Dance routines can be modified to target specific motor skills, balance, coordination, and flexibility. This improves patients' physical ability while having fun. Functional movement training. Dance movements can mimic daily activities, helping patients regain functional abilities needed for everyday tasks. Pain management. As physiotherapists, we are used to using mobilization techniques or modalities, manual therapy, etc., for pain relief. As a dance movement therapist, I started using dance movement along with physiotherapy sessions, which took care of the pain in a much better way compared to just physiotherapy modalities. So dance-based therapy can release the happy hormones, endorphins, and reduce pain perception, offering a natural form of pain management. Neurological rehabilitation, as we just spoke, dance can facilitate neuroplasticity by engaging various areas of brain. It can aid in relearning movement patterns and improving cognitive function. Cardiovascular health, dance routines can be designed to elevate heart rate and improve cardiovascular fitness, benefiting patients with heart conditions. So Zumba is one of the most commonest exercise, I would say, that is used to improve cardiovascular health in fitness centers. So if we combine physiotherapy with it, that will have a greater effect, and we can prevent injury in that way if we have a scientific background towards whatever we are planning for the individual. Social interaction. Group dance sessions create a supportive and social environment that encourages connections among participants, reducing feelings of isolation during recovery. So, if we have a group of patients who have had stroke in the past, and if we conduct group sessions for them, they will be in a better position because they'll not be feeling lonely. Oh, I'm the only one who's suffering, or what have I done? Why am I suffering? So when they have a group of people with similar condition, they look at the treatment in a different way. They look at themselves in a different way, which is more important, and which will actually accelerate their healing process. Self-expression. Dance allows individuals to express themselves creatively, aiding emotional healing and boosting self-esteem. Nowadays, there are various psychological centers which are approaching dance movement therapists to conduct sessions with them, especially in de-addiction centers, or different setups where there are psychological patients coming into picture on a daily basis, cancer survivors. So this self-expression point is very important, as in patients who have suffered chronic conditions like cancer, or maybe have been addicted to alcohol or any kind of drug. They have never got a chance to express why have they have to suffer this, or they have no reason to it. They couldn't express to anyone about how it has affected them over the past years or months that they've been going through this disease or this addiction. But when they come to us, when they come to dance movement therapists, they are at a position where they do not have to speak initially, of course, but they use their body language, their way of moving their body, to help us understand what can be the problem. What was the reason for them to feel this kind of resentment or guilt or whatever emotion they are going through. Self expression plays a very important role in this integration process. Mind body connection helps patients become more attuned to their bodies and promoting relaxation and stress reduction. Many patients skip their physiotherapy sessions because it's, especially fitness freaks who are into gyms and they're used to doing these high intensity exercises. Suddenly they come to a physiotherapy setup where they have to, because of a certain injury or prevent their injury, they specifically start targeting a group of muscles or a particular area, strengthening those muscles around that area. And when it comes to a certain point where they start feeling, okay, I can get back to the gym or get back to my daily fitness routine now, they want to understand how they can get back slowly and not get back with a high intense workout. So when I tell them that you can start integrating their certain movement therapies, dance movement therapy, for example, we use rhythm. So when we use rhythm in dance movement therapy, for example, we use music which is not very fast, not very slow, but has a very definite tempo to it throughout. And we help them understand why is it important to do your exercises with this rhythm. So when we do fast movements, we are prone to injuries. When we do slow movements, we are prone to injuries. But continuing with the same rhythm plays a very important role. So this mind-body connection helps us understand that part of rhythm, for example, and the body connection, the movement connection. Posture and alignment. Dance techniques can contribute to better posture, alignment, and body awareness, reducing the risk of musculoskeletal issues. Functional rehabilitation. Dance can simulate real-life scenarios and challenges, facilitating functional rehabilitation that prepares patients for real-world and situations. So as we come to an end of this session today, I would like to thank the team once again for inviting me over for this talk and having me over for this talk today. And I would definitely want to say that I'm really grateful to Sancheti College of Physiotherapy and Sancheti Healthcare Academy for having me as their student for physiotherapy as well as PG certification in dance movement therapy. I'm really grateful to Suroshri ma'am for introducing me and having me over for this session today. So thank you.
It is always a pleasure, Karthika. And one thing which I would like to ask on behalf of the audience for today, that of course, you did share that you were a dancer, you were into dancing since a very young age. But then what made you choose, or rather, I would say, integrate and amalgamate both your profession and your passion? And where do you want to see dance and physiotherapy take the, the rehabilitation process, to make the rehabilitation process better? Where do you see dance and physiotherapy, a combination of both together?
So, like I said, as I grew into an adult and I started using more expressions in my dance routine, my dance practice, I realized there are certain times myself, I don't get time to express myself to anyone or to myself for that matter, or address my emotional issues for that matter. So I decided, why not integrate dance, not Bharatnatyam per se, but just dance movement, simple movements, simple movement repertoires into physiotherapy protocol and help people understand that there can be an emotional cause underlying to it. So, like I said in the examples that I gave, when people came to me after 2.5 years of COVID lockdown, they came with a lot of back pain issues and etc. So, I just tried to understand over a period of time, they started opening up and telling me they've had a very hectic day for the past 2.5 years throughout the COVID time, and they've never got time to, express themselves. So, dance movement therapy, like I said, as I did the course from the same institute, having such wonderful faculty during the course was a blessing, was a boon. And they really, really helped us understand what emotions are and how it can cause to pain. I mean, lead to pain without any physical cause. And we've had sessions where they conducted certain experimental, sessions with us, with the students. And there were times we started crying. That is probably because there were emotions stuck within us. There were emotions which were not let out at the right time. So that led to the crying part of it. I thought, why not help the community and, help them understand that physical pain is pain, of course, but that there can be an emotional cause underlying to it. So in the future, I see combining dance and physiotherapy, especially with patients who had chronic conditions, neurological conditions, because they are patients who are not in a position who got rid of pain or discomfort, and they take a very long period to recover. So with them, when we add dance movement therapy concepts or certain topics, they get more into about their sessions. They get more regular with their sessions. So in that way, I would like to incorporate and integrate dance and physiotherapy.
Great. I think there's a long way to go, but I'm sure that rehabilitation and healing will definitely take place in a better way, and in quality wise, I'm sure it is going to be much better if we can actually integrate both.
Yeah.
So with this, we would like to end today's session, and thank you so much, Dr. Karthika Prasad, for sparing your valuable time. And I'm sure that we will look forward to more such sessions where you can discuss can discuss with our audience about actually how in patient care you are administering it, and what are the results we are getting, that how it is benefiting our patients, both physiotherapy and dance
Yes.
movement.
Thank you so much. Thank you.
Thank you so much, and have a good day ahead.
Thank you. Thank you.